Go ahead and get started. So, question number one: what does the body do when we have too much glucose in the blood? So, when the body's glucose level, when it goes over the requirements that's needed, the pancreas releases insulin, which signals the excess glucose to be stored as glycogen in the liver and the muscle cells. This mechanism, which is a conversion of glucose into glycogen for storage, is referred to as glycogenesis. Question number two: what does the body do when we have too little glucose in the blood? So, when there's very little glucose in the blood, and it's not available from the diet, the pancreas will actually release some glucagon, which is a hormone, and this hormone promotes the conversion of glycogen into glucose through a process called glycogenolysis. Additionally, glucagon directs the liver to produce glucose from non-carbohydrate sources, such as amino acids, through a process known as gluconeogenesis. Very confusing with all the names. So, question number three: explain the differences between type 1 and type 2 diabetes and how each is typically treated. So, type 1 diabetes is also known as insulin dependent or juvenile onset diabetes. It is an autoimmune disorder where the immune system destroys insulin producing beta cells in the pancreas, resulting in a complete lack of insulin. Some of the symptoms having to do with type 1 can include excessive thirst, hunger, frequent urination, weight loss, and a risk of ketoacidosis. The management involves daily insulin injections, monitoring blood glucose level, counting carbohydrates, and maintaining regular physical activity. Lastly, type 2 diabetes, formerly known as non-insulin dependent or adult onset diabetes, is characterized by insulin resistance, where the body produces insulin but does not use it effectively. Although insulin is still produced, cells just do not respond to the insulin that is produced, leading to just elevated blood glucose levels. Treatment for this usually includes, lifestyle changes, diet, exercise, oral medication, and in some cases, insulin therapy. But yes, that is homework number 2. That's all 3 questions. Thank you.